The Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
G'day and Swati Karb. Well, this is an interview you need to remember. And you really need to watch the talk by Dr. Kriththa. It was wonderful, and it's about an incredibly important thing. What's more important than your brain and your brain health and your brain working properly? So this was a talk about, what can go wrong with your brain. Dementia versus brain fog, what's the difference, how to handle them, etc. So really, really important subject. How did you get interested in it in the first place? What made you choose this as your specialty?
For my specialty, and in fact, I specialty in the stroke, but for everything is important in the brain, because the brain is everything. If you lose the memory, you lose the function of your brain, the life quality is not good. That's why I choose to study about the brain.
Yeah, no. My mother had Alzheimer's, as I mentioned, but my father had a massive stroke and was paralysed down one side of his body and couldn't talk. So I unfortunately have deep experience of both things. So what are the early warning signs people should be looking at to see that, maybe my brain needs more attention? What are early warning signs?
About the warning sign is if you have a word finding difficulty for the dementia first. Word finding difficulty is
difficult finding the next word, right?
Word finding difficulty, like me. And another thing, if you have some neural deficits such as abnormal vision, abnormal speech, dizzy, weakness, numbness, needs to go to the hospital immediately.
Wow. Also, of course, apparently if you lose your hearing, it can really have a bad effect on your brain health.
For the hearing, if you have the problem with the hearing, it can bring to the memory loss in the future. It's one of the risk factors.
It's like your brain's not getting enough stimulation because you've lost your hearing.
Yes. If you have the problem with the hearing, you need to see the doctor and do the hearing test first. If it's curable, it's curable. But if it's not, maybe you need the device to help, because if you cannot help about the hearing, you can have the dementia or the memory loss in the future. It's have the risk.
And also, of course, sleeping is really important for brain health.
Yes, actually, if you have not good sleep, it's have the neuronal death, because when we sleep, the brain will clean up the garbage out. If not good sleep, the garbage will in the brain, and the garbage have the inflammation in your brain, and the neuron will dead. And after that, the neuron, if you lost as much as neuron, you have the not good memory.
Also, exercise, really good for your brain, physical exercise.
Yes, physical exercise have to more than 150 minutes per a week.
The other thing that's very big on exercise now is high-intensity interval training to really push your system at a higher speed. That's one of the things I do, is high-intensity interval training.
Yes, I think for the patient, for the people, it's not not too much high intensity. It's at a appropriate with the themselves.
Anyway, keep moving. That's one of the main things, is keep moving. Keep the circulation going to your brain, because blood circulation to your brain is unbelievably important. The other thing that's emerged recently about the brain and brain health is the gut health and the relationship between the gut and brain, the gut-brain axis. This is something that probably Western science never saw coming, right?
Yes, because the new study nowadays have some relationship about the gut and brain axis. Some infection or some virus infection in the gut can make the brain have a neuronal death.
Yeah, something that Western science never saw coming. I said it briefly when the Q&A part about how fecal matter transplants are now being used to treat some brain things, where they get fecal matter from healthy people and they transplant it into unhealthy people, and they've managed to cure some number of things. But I hope you don't mind me hogging the microphone. But there was one case, this woman picked up a very bad disease in in South America, and they went back, and she got a fecal matter transplant using her kid's fecal matter, which cured the disease, but now she's fat like a kid. So something about your gut health your gut can make you eat and get fat. So you got some more tips about, what signs that they should look at. Things like, what about if you forget where your car is? Is that brain fog or is that Alzheimer's?
It's have to if have a lot of the situation and you think it's not it's like not the normal daily life, that is you need to go to see the doctor.
Yeah, because sometimes I think, now is my car there or did I park it somewhere differently? But if I do occasionally go and I go to the wrong place and then I go, oh, it's there, but I can remember putting it there, right? That's the important thing. You can remember the process of putting it there.
I think that's not the problem. It's okay.
Oh, see, I've only got foggy brain. So far, so good. And you said you were a specialty on strokes, because sometimes people have minor strokes and they sort of ignore them and they shouldn't.
Yes, lot of the patient, when the people come to see me, a lot of the patient, if the age more than 60, have a little bit stroke in the brain, but do not have no symptom, no abnormal anything, but have a lesion.
Yeah, and that's dangerous because?
No, cause of the stroke is hypertension, diabetes, hypercholesterol, smoking, and atrial fibrillation.
Yeah, atrial fibrillation is a big one. So you really want to get moving and get your exercise in order, and make sure you check out people like Dr. Kriththa, okay? This is very, very important, and maybe you need to get a yearly checks and tests, especially if you've got some family sort of history of those sorts of things. So I think family history counts when it comes to the strokes?
Yes, sure, because the family history bring to hypercholesterol, but high blood pressure, and the diabetes can in the family history. And for the test, another thing I would like to, if you have the problem with sleep, or you have problem with the memory, or you have some problem, you can come to see the doctor. I think the early diagnosis is can help to prevention, help to early treatment and slow progression of the disease.
Yeah, so there are medications now where you can slow down the onset of Alzheimer's, yes?
Maybe not only the medication, maybe some people don't need the medication, just adjust the lifestyle. And
some supplements they can take. Just mention a couple of good supplements.
Yes, such as the magnesium or the B12, it's okay.
But, and zinc, maybe?
Yes, zinc is okay, but if you take more zinc, it can make you have the white hair. It's not white. I would like to tell that if you have the deficiency, you need to take. But if you have no deficiency, no need to take.
All righty. So that's a very good note for us to go out on. I think it was a wonderful talk and so much useful information. A must-watch video, and thank you for the interview as well. And don't forget, we are here on YouTube every week. We had a video of one woman tracked down the website and emailed and said how wonderful and creative the videos were on our YouTube channel. So check out every week. Stay tuned, okay? And stay tuned into your brain health. But for now, goodbye, Swadee Carb, and keep your gut and brain healthy, okay?